Hello, my name is Travis Burton. I am with the Kentucky Hospital Association. Thank you all so much for joining us today. We are absolutely thrilled to be here in Pikeville. We appreciate you taking a little bit of time to come out and discuss the work of your hospitals in this region and what's happening in the hospitals across our state. To kick us off today, we want to invite Larry up to the stage, the chaplain for PMC, who will bring a word of prayer before we begin with our program.
Good afternoon. Let us pray. Dear Lord, as we come before you today, we give you thanks that we're able to be here. God, we're so thankful for the people here and God, for this opportunity to learn more, to ask questions. And God, we thank you for the advancements that's been made in medical science. And God, we realize today that we have such a great team and we've got really some great promises. But Lord, we also realize that with great ability comes great responsibility. And God, as we face the challenges and the changes before us, we realize, God, that you will help us to rise to those challenges. And God, we trust in a God who never changes. And we thank you for that. Bless this event, we pray. In your name, Lord. Amen.
Thank you so much. So, to give you a little bit of background, over the last few months, the Kentucky Hospital Association has been going out across the state. We've been meeting with our hospitals, their teams, their leadership teams. We've been meeting with elected officials, county judge executives, mayors, city council people, economic development leaders, just to have a conversation about the role that local hospitals play in the economy, and also to understand and hear firsthand the projects, the ambitions of local communities across the state and how they're pursuing those. And if the hospital has a role to play, what is that role, and how can the local hospital be helpful? How can KHA be helpful? So, like I said, we've met at hospitals, we've met with Lions clubs, we've met with chambers, and I'm thrilled to be able to mark off the list, had a meeting in an arena today. So we're thrilled at this and appreciate the hospitality. We do want to take the opportunity to talk about economic development, and that's really one of the reasons we're here. Is it's not every place is like Pike County, where it's so understood by the community, the large role that the hospital is playing. And so that's one of the things we've been out and talking about, and we'll talk a little bit more about here shortly. But KHA, in addition to going out and meeting and talking with hospitals and talking about the economic impact and collecting data on that, KHA serves as the voice of hospitals in our state capital, and also in Washington, D.C. We've got a federal team that is watching what's happening up there or what's not happening up there. So a part of that mission, it's so important for meetings like this for us to hear directly from you and to engage with our communities as we work to continue to provide that representation in Frankfort to policymakers. We appreciate what Pikeville Medical and ARH, as far as advocating in Frankfort, what they offer. They're always willing to help. From time to time, we need information. From time to time, we need individuals to contact policymakers. They're always so very helpful in helping us navigate that, in helping make that happen, and helping provide the information that we need to be presenting in Frankfort. And it makes a tremendous difference. And so we want to be sure to say thank you for that. And at this time, we'll go ahead and I want to be sure we introduce our panelists. Of course, no stranger to any of you in the room, Donovan Blackburn, who leads Pikeville Medical. And Donovan, thank you for all that you do and for helping get this set up today. Nancy Galvani from the Kentucky Hospital Association. She is our president and our leader, and she does a tremendous job day in and day out advocating for hospitals and making sure we're pursuing policies that will strengthen hospitals and access to health care across Kentucky. We did have a representative from ARH who was going to be with us, but sudden situation popped up and unavoidable, and has had to send his regrets. And it happened pretty quick, so they were unable to have someone fill in his place, but they send their regards, Rocky Massey, and we're sorry he couldn't be here, but he sends his best. And if we get to do this again in the near future, he hopes to join with us. So, as I mentioned, KHA is the voice of Kentucky's hospitals in the state capitol. And Nancy, I'm going to turn to you. If you could give us a little bit of insight. A few months ago, I should say, the General Assembly completed their what we call the long session, their 60-day session, or some of the highlights that we were able to achieve during that time earlier this year.
Thank you so much, Travis. And I'd again like to thank Donovan and ARH for inviting us to be here today. And I'd just also like to say, as Travis said, we're a membership organization. We represent all the hospitals in the state, and we are their voice with our lawmakers. And we're very pleased that Donovan is a board member, as is Holly Harris Phillips and Kathy Stumbo. So both ARH and Pikeville are key participants in the board, in the leadership of KHA, and in forming the policy that we go to Frankfort and Washington and represent on your behalf. Our goal is to support our hospitals, provide the best patient care. And so one of the leading, the leading initiative that we were involved with just a few months ago, it seems like a long time ago, was the patient transport issue. And Mayor Stapleton, we were just talking about that. We had several versions of the bill, and we finally hit on a lucky number. The bill that passed was House Bill 777, so how lucky can you get with that? But it really started, and as I was saying earlier, from calls that we began getting around the issue of patients in our hospitals needing to be transferred to a higher level of care and having to wait many hours, in some cases days, to be transported. And so we know that our EMS community does a fabulous job, but oftentimes there's not enough ambulances available. And we know the worker shortage, that's across all sectors, including EMS. And so we felt like there needed to be broader access. So we began working on that issue. And again, it affects every area differently, but the crisis was very acute in your area of the state. And so we worked to make some changes. We partnered with a number of different organizations to pass something that probably not everybody was 100% in agreement with, but we felt like it was important to move legislation to address the problem and to make the ability to establish ambulance services easier and for our EMS community and for our hospitals as well, so that patients weren't waiting days to get to tertiary level services. Sometimes, some of our rural hospitals have to, of course, come into Pikeville, but sometimes Pikeville has to send services into UK. And so we didn't want to see patients being delayed and have poor outcomes as a result of that. And so we are very happy, and it took, I think we started on the very first day of the session, and it took the entire session to negotiate with all the different parties that were involved in making House Bill 777 a reality, and we were very fortunate that that passed. So that was probably our number one area that we were very proud, and we know a number of hospitals have implemented that legislation and are working to establish patient transport services, not just in Eastern Kentucky, but as we got into this, the problem's different in different areas of the state. It was a problem in our metro areas as well. Some of our hospitals couldn't even move patients between owned hospitals within the Louisville area, for example. So it was different across the state, but it was a statewide problem, and we were very pleased that we were able to address it. One of the other bills that we worked on, we called it Compassionate Patient Care, And it really, again, was trying to help the patients have additional time so that they could meet with their physicians if, for example, they were getting a serious diagnosis of cancer or something, very serious. We didn't want test results just emailed to them and then patients not understanding, what does it mean for me? What are my treatment options? And so this bill provides a very short window of time for the physician to get these test results and then be able to meet with the patient to explain, what their impact is. So we thought that that was very important as well. But we always have a very robust agenda of things that we're trying to do, for our hospitals. And at the end of the day, it's really about helping the patients.
And I want to build off something you said, but before I ask about what is next and what's coming up, one of the things I would add to that, the bill Nancy mentioned, House Bill 777, it also called for a task force to continue studying the issue. And so even though the General Assembly left, that work has been ongoing. That has meant we've continued to email and aggravate Donovan and others across the state about different recommendations that we want the legislature to take a look at, and as they not only just pass that bill, but continue to work on the regulations to implement it. But Nancy, you did say, and it does feel like yesterday we were leaving Frankfort, but we'll be getting back there in a matter of weeks. We know that members of the General Assembly, for example, today, the Republicans in the House who have now 80 seats in a 100-seat body, they're in Somerset, Kentucky, caucusing and working through some policy initiatives. So they're beginning their work. I know the Senate is going to do that tomorrow, and the various caucuses are getting together and getting ready for January. With that, we are also doing that. And Nancy, what do you think we have to look forward to in January and February when the General Assembly is back in Frankfurt?
So we have our priority legislation, which is working to improve the adequacy of the Medicaid payments to our hospitals. The short session is often challenging, Travis, because sometimes it feels like it's a regular session and there's lots of bills that are filed. And of course, we, talk to the legislators and we explain the impact of different bills on our hospitals and, work to amend bills to, make them livable if they're going to pass, or if it's really bad, convince them that maybe certain legislation doesn't need to move forward. But the thing that we're going to work on is, again, our Medicaid reimbursement. And so, Medicaid, I never know how much people know about Medicaid, but our Medicaid program has 1.6 million Kentuckians on it. And so it's a very important program. It provides great access, but unfortunately, the Medicaid program does not even pay what it costs a hospital to deliver services to the patients. And it only covers like 80% of the actual cost. So that's not the charges, that's the actual cost. And so when you have so many people on that kind of a program being paid less than cost, that's not a sustainable model. So one of the things that we are working on is with the legislature to find a way to bring those rates up to be, certainly covering costs and at a little bit above costs. And so there's some programs where we can make supplemental payments to our hospitals based upon the numbers of Medicaid patients that they treat. The General Assembly worked with us to put a program in place to increase the payments on an inpatient basis. And so now we're going to work to see if we can't get higher payments for outpatient services. And that's really important for rural hospitals, because if you think about it, more of inpatient services are probably going to be provided in your larger metropolitan areas. And so today, the inpatient payments, the additional payments are going, the majority of those, to our urban centers, not as much to the rural hospitals. But if you look at outpatient services, proportionately, our rural hospitals provide a lot more outpatient services. And so if we are able to get this higher reimbursement, it's going to go proportionally more to our rural hospitals like Pikeville and ARH. And so that's going to be important to your area of the state by bringing more of those dollars into the rural areas of our state, and certainly to Eastern Kentucky.
So, Donovan, I would like, if you would, to take just a few moments and let us know a little bit about your all's operation. And I know probably most in the crowd are familiar with your all's work. But just tell us a little bit about your hospital.
Travis, I will. Before I get started and answer the question, let me make a couple of comments as well. First of all, I appreciate deeply for each and every one of you taking time that came out today to participate and to listen to this issue. As I was listening to Nancy talk, and the work that KHA and especially under Nancy's leadership has been absolutely phenomenal for healthcare and for the state of Kentucky in the name of healthcare. But when I look across the crowd and I see representatives from multiple counties, I see representatives from different business sectors, from the healthcare sector, our friends from ARH has representation here and would have been on stage with us if it hadn't been for what had occurred today. But why is it important, and why is it important for us to all come together and to have these kind of discussions, is because when you look specifically at Eastern Kentucky and what healthcare represents, it is about quality of life and offering the care that is needed. But it's also more than that. It's an economic tool for all of Eastern Kentucky. When you look at what healthcare represents specifically for our part of the county and state for that matter, between ARH and Pikeville Medical Center, we have over 10,000 employees that are employed directly by our hospitals. That doesn't count all the different services that are required to be able to support who and what we do. So when we talk about legislative initiatives and issues and things less that comes out of the state or through the legislators, I'll get it out in a second, it's extremely important for us to be able to pay attention and to have a voice and to take a very active or proactive role in what that piece of legislation represents and how it impacts our business in particular. Because when you take ARH and Pikeville Medical Center out of the equation, specifically in Eastern Kentucky, not only does it impact the patients that we care for, and unfortunately, as we all know, we lead the nation in pulmonary, heart disease, cancer rates, etc. So it's very important that we are kept stable and growing and supported in the role that we serve throughout Eastern Kentucky and throughout our entire region. But it's also more important than that. When we look at the dollars that's reinvested in our community and the services that are generated and businesses that are generated around us, it creates an economy. When you look at, and coming from government, when you look at what it creates on tax rolls and being reinvested in a community, it makes a difference in what our way of life is specifically throughout all of Eastern Kentucky. So it's important, and when I say I appreciate you coming out, I appreciate it more than you know, because learning about, again, what the number one sector means and what's happening at both ARH and Pikeville Medical Center and all the other local providers that we depend upon to support our product, it's extremely important for the community to understand these topics, because there's some things that you'll hear, I'm sure, as we go down the line a little bit, that are concerning. And, candidly, I'll say this to Nancy and to the governor and the previous administration. If it had not been for their work and through HRIP, which is what Nancy was alluding to a moment ago, then hospitals would be in a lot different position today in Kentucky than they are. As a matter of fact, we are still struggling, but we would not be struggling to the point to where we would be. And more than likely, it would result, and I know I'm kind of getting ahead of some of the questions here in a minute, but it could result in either delay or the discontinuation of various services. So I'm very appreciative for Nancy and the rest of the board for allowing myself and Holly to serve and to have a voice on Eastern Kentucky's behalf with not only the Hospital Association, but in the legislature also. Working less, Nancy mentioned House Bill 777, having that past relationship with J.D. Cheney when I was working for the KLC, was able to reach out and have discussions not only with them, but multiple organizations that really allowed us to come together to support what 777 meant. We have Dale Morton in the crowd right now, and listening to Dale and to the staff in the ER, knowing what was happening to our community with the delay of care or being able to bring people both in and out of our hospitals at a time of need, to be able to transfer them to either a higher level of care or just to simply get them back to the nursing home, and what that meant for their quality of care without burning resources at a time to where we should be concentrating on patients who may have COVID or the flu. So all this means something to our community. And by you coming out and learning more and more about what that is and why that's important says a lot about you. So I just wanted to take a few moments and thank Nancy specifically for her work. I came on board over 5 years ago, Travis, and at that time, it was right before Nancy came on board. And though KHA played a huge part in what we were doing, and as a new CEO, it was important to have somebody to lean on, but then to have a Nancy Galvani come into position and really take a very aggressive approach in making sure that hospitals were put in the forefront and making sure that we were addressing and we were lobbying for specific legislation means more than I think she'll even know to a community that really depends upon not only healthcare but to us as a facility. So I appreciate it. And then to answer Travis's question, Pikeville Medical Center I'm very proud to be part of, and for those of you that are in the audience that are wearing the badge, I'm extremely appreciative for your dedication and hard work and what you mean to this community. Pikeville Medical Center isn't just a hospital, but as I mentioned, we have over 3,100 employees just in our employment here alone. When you look across the region, we have employees from 34 different counties. 450 of those less are in Floyd County that travel every day to the hospital to services to make sure that they're taking care of our community. We're a higher level of care, so that means that we are also a transfer center. We are the only level 2 trauma center hospital in the state of Kentucky. There is 2 level 1s, which is UK and U of L, and we all know that the difference in the designation between 1 and 2 is that they're a training or a teaching hospital. So what we offer is not only a higher level of care and multiple services through our clinical services. So as everybody knows in the community, the PMC clinic has services from one end of the spectrum to the other. Matter of fact, we had this talk recently, Nancy, and when you look at UK, which we do have to at times send patients to UK for a high level of care, things that we don't or can't take care of. But more and more we're able to keep people home. And more making investments in things like pediatric care and being able to have a children's hospital in Eastern Kentucky. We've seen more and more of our kids now with flu not having to be flown out, to be able to stay at home. And that's important, for, again, everybody that's in this room and for the support that we've had. So we're proud. We're very proud of the investments that have been made. I'm very proud of the staff. Over the last 2 years, I know, Nancy, we talk about COVID, unfortunately, way too much. But what this hospital's represented and meant to this community, not just Pike County, but all surrounding counties, to be able to combat things like COVID, to open an advanced heart and vascular center, to open the first children's hospital, to open an autism center, speaks volumes of those that are sitting around the room. So, and likewise, I know my counterparts with ARH isn't here. Holly Phillips, who is my counterpart, I saw Dalton in the room a moment ago, is a great friend and a great supporter. We receive a tremendous amount of business from ARH in the sense of transfer of business, of bringing, again, patients that need a higher level of care or different types of treatment. So Holly and I have, over the last year, have gotten really to know each other really well. And a lot of that is because of the current financial position that we're in. But also we realize that our role as hospitals in a community that desperately needs the services that we provide. So again, I appreciate your attendance here today. I look forward to the rest of the discussion. And Travis, Nancy, can't thank you enough for coming down from Louisville and spending some time with us today and to help educate our community, which is very proud of our brand, both ARH and PMC, and what legislative initiatives, concerns, and all the things that's going on in and around the healthcare industry. Thank you.
Thank you, Donovan. And no, to build off what you said, what an impact you all make. And it's very clear, even as we were driving into town, just the footprint that you all have and ARH has in this area is tremendous. Nancy, I did want to ask if there was anything kind of you wanted to add from the statewide perspective about the economic impact we see here in Eastern Kentucky, or really even the economic impact that hospitals are making across the state.
Right, so I think Donovan certainly explained the economic impact here locally, but I think people don't always think about hospitals for their economic importance. We know hospitals are there 24/7, always there to serve the community. They think about healthcare, but people don't always think about the economic importance, the jobs that are created. And so one of the things we're trying to do is educate our elected officials about that, to think about that hospitals are also large employers. And, we're a rural state, so in many rural areas, the hospital is the largest employer or maybe the second largest employer. And so if you think about just the employment, not just are they employing people, but, doctors, nurses, highly specialized, skilled people, they pay a higher wage usually within the community as well. And so there's the ripple effect of the spending that the local hospital makes, that their employees make, the payroll taxes, and on and on and on, that is really key to an area. And so it's very devastating when hospitals close. And for the most recent closure that we had was up in the Ashland area. The Our Lady of Bellefonte Hospital closed. I think we didn't really see that coming. But, the local area lost, a tremendous amount of money just in the payroll taxes. So it can be very devastating, and it's also hard to recruit other industry to areas that do not have a hospital, because that's one of the things that industry, if a company's coming into an area, they want to make sure that they have good local health care. So when we look at this on a statewide basis, our hospitals are actually, we think about Kentucky, I'll go back and say, we always think about bourbon and horses, the two signature industries. But actually, hospitals have a bigger economic impact to our state, and they employ more people. So Kentucky hospitals employ over 75,000 people in our state, and the economic benefit to our state is over $13 billion. And that is more than both the equine and the bourbon industry in terms of economic importance and employment. But yet people don't think about healthcare as really being one of our leading industries. And so we're trying to get that word out so that people understand the importance of their hospitals, not just there when you need to get care, but it's an important foundation for the community and something that we have to, we have to support financially. And that's why the reimbursement rates are very important, because we don't want to lose any of our hospitals. And what Donovan alluded to, I'm on all sorts of, emails. Everybody gets 20 million emails, and I'm on a lot of different emails to look at what's going on nationally. And right now, you can read an email every day that talks about hospitals closing across the nation. And I'm not just talking about little hospitals that were on their last leg anyway. I'm talking about major medical centers closing, hospitals laying off. Every day you read these articles, hospitals stopping services, hospitals that can't provide inpatient care anymore. And so what that means is it's a lack of access. At the end of the day, you don't want that to happen, because your population then has to travel further to get services. And, unfortunately, we're already starting to see some of that, and we're kind of getting into workforce, and there's some other reasons for that. But we are seeing the financial challenges today for a variety of reasons that are having hospitals across this country close, and we're so thankful that we haven't seen that yet in Kentucky.
Well, and back to the horses and bourbon, we certainly also want to give them their credit that when you mix horses and bourbon together, that also sometimes provides foot traffic to our hospitals for some business. So we want to give them their due credit, of course. But no, I think, and we've talked about the challenges, and we've even already kind of talked about possible solutions, and we know that former policies that had been pursued and adopted have helped us avoid dire situations. But with the financial situation, with hospitals, many of which are going to end the year operating in the red, and like Nancy said, many of which are on the verge of, and I'm talking really national, not necessarily here in Kentucky, but hospitals shutting down. And Donovan, we'll kick off with you. What are some of the driving factors that are creating the financial hardships for hospitals?
Well, there's several. And of course, the circumstances that we have faced over the last 2 years have really led us to the path that we're on. And administrators across the state and the country, for that matter, this is pretty much in every boardroom and at the forefront of every administrator talking to other administrators in hospitals. Nancy already alluded to it, and it is fact that when you look at Becker's just recent report that came out, over 630 hospitals in the nation right now that are in critical mass and concern for closing. When you look at not just the hospitals that are closing, but also the economic, it wasn't me, the economic impact that we're seeing hospitals take because of what's happened with inflation and wage inflation and just travelers, which is part of the wage inflation issue, which we all know, and I'll get into that in just a second. But when we talk about the economic impact, specifically, and speaking with about PMC, and I'm sure my counterpart would have said the same thing from ARH. I just saw Mayor Carter and Philip walk in Ellsworth with the city, but most of you know that I served in a capacity with the city before, but when you look at the impact that we have on Eastern Kentucky, the largest geographic, Pike County being the largest geographic state or county in the state, Pikeville being a county seat, we represent about 50% of their total occupational tax, and we represent about 27% of the total county's wages. So it is alarming and concerning to hospitals when you see the impact that $100 million a year of investments, $225 million in salaries that are created, that reinvested back into the community. And it's not just us. We have a lot of other providers in the market that depends upon us, and we depend upon the services that they provide. So it is important to understand what is happening, and why it's important is as we're talking to our state and federal partners, that they also understand that the work that they've done with KHA last year, Nancy, with HRIP, that again, I'll say it very loudly, if it had not been for HRIP, then you would probably be reading about more Kentucky hospitals in some of the same shape that you're seeing other hospitals. When you see hospitals like Cleveland Clinic losing over $1 billion a year, or Mayo, 60-70% of the income down, the projections down. When you look at hospitals throughout the region like Ballad and Pikeville Medical Center and ARH that are operating in the red, that's no secret. We've been very vocal about that. But even in the red, we're significant, but coming out of it. And the reason that we're coming out of it is because we're making investments in workforce. We have great people working on our behalf with the legislators to ensure that they know and understand the importance of HRIP and bringing those dollars to Eastern Kentucky. While we're bringing those dollars in, it's not just about money. It's also about improving the quality matrix, the things that we offer to the community and to the patients, to make sure that we're also homing our skills and improving our performance overall. But there is a concern, and the concern is really being driven by the last 2 years of less, just say it as it is. Most of you know me, and I'm very transparent. But when you look at and Paul Patton's here, and we appreciate our relationship with the university. But if it wasn't for our relationships with places like UPike, University of Pikeville, and Big Sandy, and ANU, and Galen, then we would really be in trouble. Because what we saw is that nurses or students who were be required to be vaccinated early on, they weren't signing up for college. They weren't going to nursing school. So you see numbers down. You see a higher number of employees retiring, nurses specifically retiring at an all-time rate. And on top of that, then you bring in the traveler factor, to where before we saw nurses, which I'm for travelers, I want that clearly stated, it's necessary in our business. But to see travelers go from 34 travelers in 1 year, and all of a sudden a year later we were at 170 travelers, paying a premium price, had a significant, a $4 million a month impact on Pikeville Medical Center alone. I know all my colleagues have the same exact story. And then when you look at inflation and what our country has gone through, not only transportation costs, and on top of that, things like pharmaceuticals, and what we're paying for compared to what we paid in the past. It's just unfathomable of what that cost layered on top of itself has created. And then you look at things like KHA had fought for, why 777 was important. It wasn't just because we wanted to be able to transfer people in, but hospitals saw themselves at capacity over the last 2 years because of COVID and influenza and different type of diseases, and not being able to free up those beds to get patients back to home or to the nursing home or to other hospitals of care created a resource burn that wasn't necessary. So spending a little, you can save a lot, not to mention the quality of care that you're improving for the patient. So there's a lot of different things all at one time that kind of came together that's impacted healthcare. I know Tammy from the health department, nobody was unscathed in this. We all feel this. Anybody that's in the healthcare, and also recognize that around the country, businesses, inflation is impacting them in different ways. But what you heard Nancy say, like a lot of hospitals in Kentucky, our payer mix is 77% government-based, Medicaid, Medicare. When you take, and ARH's, by the way, is the same as that percentage. So when you look at Eastern Kentucky, imagine 77% of your reimbursement is set by the state and federal government. That usually isn't tweaked, but maybe once a year. When it is tweaked, it's a small percentage. And even though we just saw the largest percent increase in Medicare, 4% that's coming down in January, if you look at what our salaries and all of our other expenses, how much they have gone up, tell me a business to where when you see inflation that you don't have the opportunity of raising rates or raising prices. So there's a false known fact out there, Travis, is that people look at hospitals and assume that they're very wealthy because you have doctors and nurses and people that are in a good profession. But the fact of the matter is traditionally most of those hospitals, especially in the rural parts of the state, as Nancy alluded to, their margins are usually 1% and 2% if they're lucky. And here in the last 2 years, they've not been 1% or 2%, they've been on the other side. So there's a huge concern of not only what has happened, but what will more than likely continue to happen over the next couple of years to come until we get a handle on a few things, such as working through things like outpatient HRIP, which is extremely important from a legislative perspective. I encourage anybody that talks to the legislators to understand that when you look at Eastern Kentucky, the number one business in Eastern Kentucky, not just what we provide, but the number one business is in need of support, needing to be propped up. We've been very blessed to have good partners to be able to work with, but all this is having impact, and it's having impact in communities where we need to really pay attention. We really do, because again, it's not just about a hospital. It's about having a hospital, as Nancy mentioned, Philip and Jimmy, that as you're recruiting to the industrial park, try to recruit somebody in when you tell them, I'm sorry, our hospital just closed. It won't happen.
Well, and Nancy, kind of building off what Donovan said, if you have anything to add on the drivers of the finances, but also, KHA recently released a report detailing the staffing crisis. And so if you'd want to speak a little bit to that, I think.
Happy to do that, Travis. So kind of getting back to what Donovan was saying, people think, to your point, hospitals are wealthy. And that is not true because, as you mentioned, on any given day, 70 to 80% of the patients are on a government program. The government sets the rates and they're below cost. When you look at the expenses in a hospital, 75% of the expenses are in three categories. That's labor, which is more than 50%, supplies, and drugs. And so we've been tracking cost increases. So if you put that in perspective, pre-pandemic to today, where are we? So the total cost of patient care is up about 25 to 30% total expenses. Drug costs up 40%. Labor costs are skyrocketing. And so to Travis's point, we just looked at a report. We surveyed all of our hospitals to find out how short we are with labor. And what we found is that we have openings for over 13,000 workers in our hospitals, and about 5,000 of those are nurses. And it's the most critical shortage, and this isn't just Kentucky, this is nationally, it's the most critical shortage that hospitals have faced in a long time. And that's for a variety of reasons. Of course, COVID took a toll on workers. So people that were close to retirement, they're retiring. And that's not just even in healthcare. I mean, you just see this across the board. A lot of people that might have, continued to work, they said they had enough. You had people leave the profession, young nurses that said, I don't want to do this anymore. And then you have not enough people in the pipeline to replace those that would have been leaving. So, not enough people choosing healthcare. And then what do we hear? People are on TikTok, on social media saying, what a terrible profession it is, which of course is not true. But, then it discourages people from wanting to get into healthcare. So, we're facing, that as well. And then we have an aging population in the state. We're seeing our length of stay in our hospitals go up. So we are seeing sicker patients in our hospitals. And, we have in Kentucky, what are we, 50th in practically every chronic disease that's out there. And so we need more healthcare workers than maybe, some healthier places. So all of that kind of creates this, perfect storm that we're dealing with right now. And the problem with, the nursing shortage is that it's a national problem. And unfortunately, we've had to rely on more travel staff. And the problem is, again, it's a national issue. So when COVID hit, and I sort of remember when this happened, it came in waves. So it hit, California, New York, and then those states started recruiting nurses out of the rest of the country. And so that's when you really started to see the growth of the travel nurse industry. And then by the time it hit Kentucky, we had already lost some of those nurses, and it kind of grew from there. And so when we looked at and we surveyed our members how much more they're having to spend in labor costs, so number one, you have to keep the staff that you have, so that's premium pay. And just order of magnitude, in 2019, hospitals in Kentucky spent $50 million. This year, they're projected to spend $400 million. That's a 600% increase just around keeping overtime and premium pay for the staff you have. When we looked at the travel nurses, the cost of the travel nurses in 2019 was $88 million. And by the end of this year, it's projected to be $1 billion with a B. $1 billion, that's a 1,000% increase. So obviously, how is that sustainable when, Donovan, 77% of your patients are on Medicare and Medicaid that are paying you less than cost? It's not sustainable, which is why we're working to get Medicaid reimbursement increased. We're working with our congressional delegation to look at, Medicare reimbursement, because Kentucky has paid way less in Medicare. People don't realize, they think we negotiate with Medicare. We don't. The federal government sets what we are paid, and because we're a low-cost state, we get paid less. And yet we're paying the same, rates for travel nurses. There's no cheaper rate for Kentucky because we're low cost. We're competing against California and New York and the wealthier states because it's a national rate. And so that is not a sustainable model. So, we'll be working to do what we can on that front as well. And of course, we have to all work together. And of course, Pikeville is a great leader in really creating a program to address the workforce shortage. And that's going to be key.
And that was actually my next question. Tim Hatfield from ARH and myself both serve on the board of a program called Jobs for America's Graduates. And through that program, we've seen the work of Pikeville Medical in putting together a book that is right there. And so I've heard about it through my involvement in JAG, and the KHA has taken a look at it, and I know there's different groups around the state that have been talking with Donovan and his team about this book to get in front of students and help them understand the many different career pathways. So I do want to turn to Donovan, and if you could tell us a little bit about that, and what other things can we be doing short term, but also long term to deal with the workforce crisis?
Well, Travis, there's a very long answer to that. I'll try to make it short because there's been so much done. And again, I give credit. Eric Blackburn's in the crowd today, to him and to the entire HR and recruitment team. We started actually about 4 years ago, and I went and looked at what the attrition rate was for nursing. And at that time, the University of Pikeville was producing, they had about 30 nurses in the program, and realized if you look at the attrition rate nationwide, it was about 17%, 17.2. And when we look at the number of nurses that we have at the hospital, then we were going to always turn about 150 nurses a year. So actually, not only working with the University of Pikeville, But at the time, Philip Ellswick was also on the board, advisory board for Big Sandy, and asked Philip to come to the office, and we had these discussions. So it started then with an acronym like we do with so many things, and we created Project HEART, which was healthcare employment around regional training. And it started with bringing in the partners, the right partners. So what we've done is realizing that, we're paying a lot of hospitals throughout the country in order to retain employees, nurses, we're paying a bonus. And the intent of that bonus was to get them to commit to stay. We also realize that if you look at the economics of what a traveler costs, and as Nancy explained, when you look at 1,000% increase or going from 100 million to $1 billion, from our hospital, we did a real simple feasibility study to determine what that cost was. And what we realized is we could pull a fraction of that money out, reinvest in education, and put more nurses that have an interest. We have Bobby Jones is here with us today, that works for us now, used to work for the school system here, the independent school system. And the importance of positions like that was putting our own people in the school systems to give them an opportunity to hear about what healthcare jobs, what they were all about, what they paid, the pathway to get there. But then the intent was to create that pathway and determining what schools in the area actually have these type of programs. Part of the problem that we see throughout the rural parts of our state is that a lot of the educational infrastructure isn't strong enough to really produce the amount of staff that's actually needed to support the healthcare within our entire state. In the past, traditionally, we've been able to pull people out of places like Charleston, West Virginia, or Huntington, or Lexington, or Ashland. But those hospitals were in great need too, just like we are. So they've not only increased their rates, they've offered incentives to get people to stay. So it did take long, 4 years ago, to realize that if we can educate folks here, give them the opportunity here, create the relationship with them here, that they'll stay here. And that we have great people that want to be here. A lot of you are in the crowd here today. So it was developing relationships with first the University of Pikeville. We went in working with the governor. We were able to get an executive order that kind of cleared the pathway initially before Senate Bill 10 came into play, which allowed the University of Pikeville to expand their nursing seats without going through a year-long ordeal through the Board of Nursing. It allowed them to expand from 60 seats. And if you remember what I just said, that 4 years ago they had only 30 seats. So it went from 30 seats to 45 seats to 60 seats, to where I'm happy that with the work of the governor, we were able to get them actually up to 120 seats currently, and there's a factor they can go above. So this year they'll have around 140 students in their program, which is absolutely phenomenal. On top of that, working with Big Sandy Community Technical College, Pikeville Medical Center actually offered a building, got a grant again through the state, and was able to develop the infrastructure needed to create a pathway there. Peggy is in the audience here today. She played a huge role in that, as well as Michelle Rainey. We were able to again put a program there that had 30 nurse seats and growing up to 45. As part of that program, we also asked them to look at creating CNA programs so that we can get some basic instruction exposure to maybe kids or community members that are non-traditional students that would have interest in getting into healthcare. From there, we grew into a creating relationship with Galen, realizing that we had now hit the RN market, but a lot of hospitals are now looking also at an LPN, kind of the model that we used to have years ago of bringing more LPNs and offering a bridge type program so that we can transfer them from an LPN to an RN. Through the work of KHA, we're also hoping and working through the state, working with our local school systems to hopefully create a LPN program in our school systems, which would be a great feeder program because you bring somebody out of high school that can pass a board as a practical nurse, allow them to take their exam, they come straight out of high school making $23 an hour. With the opportunity then of going into a 1 year to 14 months, depending upon what program it is, to a bridge program, to all of a sudden they're starting out at $29, $30 an hour. A great living wage in a very noble profession of being able to stay in eastern Kentucky where there's great opportunity. But it didn't stop there. We went into also forming relationships with places like JAG, SOAR, and several others, EKSEP. We were able to get grants to be able to create new programs to allow the community to be actually train while they were being paid, to become a phlebotomist or to become a CNA, a medical assistant. And so we've been able to fill a lot of our gaps that way. We also were able to bring in Galen. And the reason Galen was important is because they were pursuing an LPN program. U-Pike was pursuing a RN program. Galen, the difference is that most of their students, matter of fact, 90% of their students are non-traditional. So it's a different labor pool, or different pool, Brianna, as you know, that UK or U-Pike, along with Galen, of who they actually go after. And then on top of that, we realize it's not just about nursing. Other positions, when you look at every other hospital, you can go down the list and everybody's going to tell you the same thing. We don't have enough MLTs. We don't have enough rad techs. We don't have enough respiratory therapists. Dwight, we have enough now because we made some adjustments. We created partnerships, and not just in Kentucky, by the way. We also have partners in West Virginia. So as part of that, the booklet was created, which was a pathway. It created a QR code that allowed a student, whether young or old, to look at that profession and see what it actually meant. What do I do if I'm an LPN? What do I do if I'm an MA? So then Christian, I also gave them a goal of hiring 150 nurses this year. And I'm happy to announce we surpassed that. So educating people, open communication, giving them a pathway, creating, again, materials so they can kind of see not only what they want to be, but what it really means. And then marrying them with these different institutions that we've created relationships with. And then we've also, in each case, created scholarship type opportunities for a commitment to work for PMC for 1, 2, 3 years. On top of that, working with the University of Pikeville, we created a fellowship program, which committed if a student went through that program, that not only would their tuition more than likely be almost fully paid, if not fully paid, but they would have an opportunity to come work for us for not only 3 years, but if so, they chose to leave early, or if we elected not to hire them, they could go out into the field. We would still put the payment up, but they would go out in the field and be able to work for a competitor. Because it's not just about serving our need. It's about, and that's why KHA is involved in this as well, and all the other hospitals. It's about all of us pulling together as educators, as administrators, as organizations to support both, as those are in the legislature, to be able to put money up to understand that if we don't support healthcare, if we don't create a pathway to fill all these open positions that Nancy's talked about, then we're going to be in trouble, because we're never going to be outpace what that payroll cost and what we're going to see year after year after year. The solution is in education, communication, partnerships, but it's also going to take some initial investments to be able to get there. So one of the things I'm most proud of, Nancy, as we talk about these programs, is the partners that we have been able to bring along, is to have, again, a university that understands the need and are willing to make that type of investment, to be able to grow and expand their class, because we're talking about a 2-year program and a 4-year college. We're also talking about Big Sandy, or KCTCS, and sitting in a meeting, I can remember over a year ago, with the system president and saying we're going to commit. And James Glasses, I think I saw him in the room, has worked with them to be able to get them to invest in not just nursing, but other programs, not just in Prestonsburg, but to expand that to places like Pikeville, so that everybody has the opportunity to work not only in a hospital, but close to home. So anybody, I early on, I created a little team, and there's about 9 or 10 of us that sit on the committee. We meet every 2 weeks now. We were meeting weekly, and that's involved in all this. And I remember when I wanted this put together, I got a background in marketing and said, I want to create this booklet, and we just, PR marketing, talked about what it would become, and we saw the success of it when we went to schools. We went to Pike County school system, Travis, and we met on the last couple of weeks, and we went to other counties as well, but I use Pike County as an example. We met with every junior and senior that wanted to meet with us. Over 700 students we met with. And we created a little program online with their phone, and we went through this booklet, and Christian, as a matter of fact, Hagee led the way with his team. And now the 700 students that we met with at the end of this, we said, okay, we've been told, by the way, several times that there just wasn't enough interest in kids going into this field. After we met and after we showed them the career path, how much they can make, why they could stay home, what kind of earnings, not only it's about the earnings, but what they would be doing, we then said, every junior and senior in here that has an interest in becoming an RN, raise your hand. On that day, 350 hands went up. And on that day, I can remember about 2 weeks later, Burton Webb calling me saying, whatever you're doing, this was at the university, please stop, slow down. Because we've got so many kids lined around the corner, we can't get them all into our program. And then House Bill 777 said, if you don't have room for them, you got to tell them who else has an opening. So there's been a lot of work to really address this. It is a crisis. It's a crisis not only here in our part of the state, but throughout the entire country. And the way that we're going to solve this crisis and put people to work in Eastern Kentucky, because as I tell, if you look through the booklet, Travis, it's broken down by color code. So I tell people, if you don't want to, sorry my language, but this is what I say, if you don't want to touch blood and urine, that's fine. We've got a different pathway for you. We can put you down to become a pharmacy tech, a medical assistant. There's so many different pathways that we are a small city. When you look at hospitals, we have everything from maintenance to IT to administration, all kinds of different positions, all in one unit. So healthcare is definitely an industry that is going to be around. There's unfortunately always going to be sick people. And as Nancy said, we have an aging population. And unfortunately, in our part of the state, we have a sick population. So it's a great career path that we need to get all of our educators, all of our legislators, all of our community leaders, and that's why you're here today, to understand this story. Because if we continue to outmigrate our people, and we continue to not offer the services that are needed to allow our communities to continue to grow and prosper, then without vision, the people will perish. And that's what we're seeing. We've now created a mechanism to allow our kids to stay home in so many different fields and earn a great wage, and better than that, to be able to serve their community, to be able to take care of their moms and their dads and their grandpas and their sisters and their brothers. It's been a great blessing. And I've had, many of you know my path, I've had several career paths and going everywhere from retail to government. But I've been so humbled to be in this profession for the last 5 years and knowing what it means and to our community. And then, Nancy, to live through a pandemic on top of that. I laugh at Nancy and myself too, because we came into positions of leadership at a time where our history has been changed. So it is important work that everyone in here, it's important what you do. It's not just important that we created a booklet that we're proud of and that other parts of the state are utilizing, but it's important because of what this industry means to your part of the country and your part of the state right now.
So, and thank you so much, Donovan, for being a leader in that front. Obviously, several of the topics we've covered today, we've talked about the challenges, and so it's really exciting to hear you all bringing solutions to the table. One of the things as we begin to wrap up today that we did want to bring some light to is that, yes, and especially you all in this room in healthcare and as community leaders know that the global pandemic that we went through was something that brought tremendous challenges to every field, to every sector. But there was, in some instances, silver linings that could be identified. And so, Nancy, what have you seen across the state and hearing from your colleagues, maybe in other states, what good came from COVID? When you put the challenges aside, what did we gain?
I have to say, the number one thing I've seen is an appreciation for the rural hospitals. I've been at the association a long time. I've been in government affairs a long time. And I can remember years in the past, I'd be in Frankfurt, and sometimes legislators felt like, well, some of the rural hospitals, we don't really need them. No one's going to them. And COVID totally 180 degrees changed that. Now when I testify, and I get called to testify quite a bit, I am asked, what about the rural hospitals? Are the rural hospitals in danger? Everybody's worried about the rural hospitals, and the legislators understand the importance of every single hospital in the state and the rural hospitals because they all played such a vital part during COVID. We were the front door. We were the ones that were there, really leading this state. We're the ones that I think got us through because the hospitals rose to the occasion. The hospitals almost, really were the public health entities. The hospitals, were the ones on the front lines. treating COVID when the vaccination came out, the hospitals were the vaccination sites. I mean, Pikeville Medical Center and ARH were the leading among, a small group of hospitals that were in regular meetings with the governor, advising the governor on the COVID policy. But we're stepping up every step of the way, having testing, drive-through testing, vaccination sites, you name it. The hospitals were the ones that I feel like pulled us through. And I feel like the governor understands that, the administration understands that, and the legislature understands that, the importance of every single hospital in the state. The other thing, I think, hospitals are certainly competitors, but the hospitals pulled together. And in the past, sometimes there's been a difference of, the rural hospitals feel like, the urbans are more important or vice versa. But I think everybody came together and realized we have to support each other. And I still feel that that's out there today. Our urban hospitals, when I talk to those CEOs, they're concerned about the rural hospitals because they understand, we can't close all the rural hospitals and have everybody go to the urban areas. I mean, that would never work. So they understand the importance of keeping the rural hospitals because of the importance of the services that are provided. So I feel like there's a more supportive environment that came from COVID. Maybe it came out of necessity, but really helping each other out. If a hospital was in trouble, then the other hospitals were always there to their defense. How can we help? What can we do? And that's carried forward with disasters. So we've had tornadoes, we've had flooding in this area, and you still see that out there. The hospitals calling each other up. Many of the hospitals, maybe didn't know each other before COVID, but, all the CEOs know each other, and they're there to help each other. So I really think that that's been a silver lining coming out of COVID, is our ability to work together, and especially around these disasters, come together. We learned a lot during COVID, and the hospitals are the ones, not only providing health care, but providing a lot of the public health and the disaster management in the state.
Donovan, how about you? Were you able to use COVID as a way to expand any services?
Yeah, yes, we did. We learned a lot, and Nancy nailed it. What it did for us is it opened up lines of communication that we never knew before, not just with other administrators, which was great. Again, you've heard me say my counterpart with ARH, Holly, and I have become very close because, in all sincerity, because of what we have faced the last little bit. Even though we've been in the same market, we're competitors. We have a lot of commonalities, and we work together quite well. The other thing from our perspective, that it created was a line of communication and acknowledgement from the administration that I hadn't had before COVID. A good example of that is that Steve Stack, everybody knows Dr. Stack, texted me today on an issue. And that communication, we text each other quite frequently on different issues. Same thing with Secretary Freelander, of having an open dialogue and route directly to their office, and the governor for that standpoint. But it goes beyond that. One of the things that we all have to recognize too through COVID that saved hospitals was the actions of our federal partners. If it had not been for the work of our great Senator McConnell and people like Hal Rogers, then the money that we received, the stimulus funds to help us at a time where we were forced and had to close down services, cut back on certain procedures. It had a tremendous financial impact. So there's been a good equation all along the way of working with our federal and state partners on both sides of the aisle, because COVID didn't, as we said so many times, it didn't matter if you were an RD laying up in ICU. It was creating and having an impact. But it also created service lines. Kansas and Melissa, I remember standing over in the parking lot on a very cold day and saying that we needed to increase it. We were the first hospital in Eastern Kentucky that received the first shipment of vaccine. There was 10 hospitals in the state, and we were one of them. And we stood up in the corner of the lot, realizing that these people were going to line up, and said, how many shots did we give? How many needles and arms? And I think the number was around 300 or 400. And I said, we've got to do better. We got to do They said, how much better? I said, about 1,000 to 1,200. And you would have thought I was crazy. I had a third eye. And guess what? Within a week, we did 1,200 vaccines in one day. We created a system that was used throughout the state and a lot of different hospitals. And we pre-registered people before they came in. We put them in lines. We had the help, again, of the National Guard coming in for security and to protect the hospital. But we also learned services that, such as our Healthy at School initiative. That was a program that we were working on to provide a service, and being not only in the rural part of the state with rural health and as a regional provider, we also wanted a telehealth program to be able to serve the kids in the farthest rural part of our communities that may not have access to care. So it was about access. So at the same time that we were working on that program with a federal grant that we received, all of a sudden COVID hit, so we were able to use that platform to actually see patients, which we still do today. As a matter of fact, we have a new partnership. Dr. Aaron Crum is in with our new children's hospital with our pediatric clinic. We now have an outreach program with the University of Kentucky. Bringing in a cardiologist is extremely expensive, for one, when you don't have your clientele base built. It's, candidly speaking, you really can't afford to do so, but having a clinician that can serve both UK and PMC at the same time via telehealth or a visit to our clinic is extremely important. It's bringing services and preventing people from Eastern Kentucky from having to travel. One of the greatest things that we learned that our patients absolutely love, and I love it, I've told the story many, many times, I have rheumatoid arthritis. I have to have blood drawn several times a year. Coming inside and being put in the seat and doing all the things you traditionally have to do is somewhat encompassing. Now being able to stay in my car and go through a drive-through lab is great. And that's a service line that we didn't back up on. So there's been a lot of things that we've improved upon, the way that we conduct our business in our pharmacy, the way we're able to, Michelle Rainey and her staff, it was absolutely unbelievable. There's not even a word that I could put on it to watch them. Dr. Crum and I would stand back just in awe and saying that we have to flex up or flex down in the number of beds that we needed to take care of our COVID patients, because when you weren't taking care of COVID patients, you needed to put that staff elsewhere, because then we were opening back up pre-elective and elective surgeries. So we had to move them over to med-surg and be able to expand and cut back on beds and the type of different apparatuses that you needed to do it overnight, which is absolutely amazing. So I truly believe that COVID has made us better hospitals. It's allowed us to look at practices and allowed us to expand upon them, and have created conveniences that we did not know prior to this.
Well, thank you, and thank you both. We want to make sure we leave a little time. If there are any questions, we've got some microphones set up, and we can help get those to you. But are there any questions before we wrap up today?
He's laughing already, doesn't even know me. Blood and urine, Donovan. If those are the worst words you say today, God love you. That's why I call you Opie. First of all, thank you guys for coming here. It's really important to be here. I've got a lot of questions about affordable health care, about mental health care, and I think that should be said at another time. But one most specific thing I'd like to talk about is the innovation that we've had. This region is known for a lot of things that are bad: drug use, overdoses, obesity. But we're not known for job creation and job innovation. And I think what Pikeville Medical Center did and ARH did with creating jobs at the lower level, with the program that you put together, Donovan, that was just one fine publication that was printed very well, by the way, is great. It creates a lot of opportunity, creates a lot of jobs for the region. That technology, that innovation is not being spread nationwide. Case in point is 60 Minutes did during the COVID pandemic. They went to Louisville hospitals, and they saw these nurses who were on the verge of tears. And one of them said, "I'm going to quit after today's shift because I can't do this anymore." And that started the whole epidemic of the nurses going away. So if it wasn't for Pikeville Medical Center and you guys creating these jobs, we'd be in a lot more trouble than we were. So how can the KHA help not only spread the word throughout the state, but throughout the nation, that this region is not what it appears to be? And we want to be known as a job creation and innovation, as opposed to leading in obesity and heart problems and whatever else we're let in. And you know what? I'm from here. I'm one of you guys now. I need to be part of this, and you all need to help us out. So how can you do that? Thank you.
Thank you for that question. Donovan is such a leader because what he has done with this whole heart program, when we were here for the grand event, we took the booklet back and we said, we have to create this for the state. So what you're doing, you're ahead of your peers. And so you really are setting the model. And what we at KHA are trying to do is do that on a statewide basis. What you've been able to do locally, we're trying to do at a statewide level by partnering with all the different organizations, of course, that you have to talk to. Most specifically, we are talking to the 4-year programs, but we're really talking to a lot of our 2-year partners because, of course, they can train a nurse quicker. So KCTCS, which you're working with locally, we're working at a statewide level. The Galen, program, looking at LPNs in high school, what else can we put at that level? But we are doing it, of course, across the whole state. And it's like eating an elephant, what do you do first? But we are looking at how many seats do we need going forward. Not just today, it's 5,000 nurses today. What do we need in 5 years, 10 years? And then working with those schools to address that. But the other thing that is unique to Kentucky is that, and we've seen some data that kind of getting to, we don't want to be losing nurses to other states. And with 7 surrounding states, we're vulnerable to that. We are actually, losing more graduates than we are, we're, quote, a net exporter of nurses. And so there's a lot of factors, but we have to, look at that. I will just say that when I go to meetings with other state hospital associations across the country, I think we're ahead of what many are doing. And the other thing that's interesting that we have learned is that in some of the states where, there's an exodus of population, some of those young people want to actually move to areas like Kentucky, West Virginia. They're tired of being in these crowded urban areas. They're looking for, to come to maybe a rural area, in fact. But we have to, have competitive wages, which gets back to our reimbursement. But we have to sell Kentucky as well. Why should they come here? Quality of life, low taxes. So it's even beyond what the hospital can offer, but it's how do we sell Kentucky as a state? And that's something that we're going to be working with the Kentucky Chamber on. They have a huge workforce pipeline program across all industries. So that's something that we definitely are going to be looking at, and as a statewide organization partnering with the Chamber to look at kind of creating a bold program to not just keep the people we're graduating, but how do we import some of these people that are looking to move into, states like Kentucky, getting out of the New Yorks and the Californias of the world, and how can we be an importer of nurses by selling, what we have to offer here.
Any other questions on the floor? Oh, that's a good idea.
Donovan, you talked about a lot of the investment that PMC did in bricks and mortar with the Heart and Vascular Institute and the Med2 Children's Hospital, and then in human resources investment with the training project. But I know that PMC recently has made a significant investment into computer system going live up on Epic. So what does leadership see will be the benefit and the improvement to the care of our patients and a relationship with other organizations that we partner with?
Peggy, it's a great question. And that, Epic was, when you look across the nation, there's been several stories that's come out on Becker's here lately about hospitals making more and more investments in a better EHR. Pikeville Medical Center, it was a significant investment. As far as we're concerned, I think everybody else in our field will say that Epic is the leading EHR system in the nation. We made that investment not lightly. We did a lot of due diligence to make sure that it was the right thing for us. And we realized, and again, Nancy alluded to it earlier, that when you're doing business with places like UK regularly, having a system that can interface between us and be able to move data between one patient to the other because of HIPAA guidelines, all the other things that were mandated to do, but also from a patient's convenience, was extremely important. When you looked at our system before, and anybody and I was trying to look across the audience, see if I saw anybody here from IT, we had over 30 platforms all communicating and going and trying to communicate with one another. A lot of those platforms weren't really supported. And if you look at the growth that Pikeville Medical Center has seen over the past several years, it was important that we not only invested in a system, but a system that would be around for a while and that would be able to evolve as healthcare evolves. There was no better system, obviously, on our radar than an Epic system. But it goes beyond that, too. For the first time since I've been here, and I guess even my lifetime, being a patient, having access to your care. To be able, giving the patients the opportunity to actually manage their care for the first time in a way of communicating with the provider, setting up appointments, receiving labs, actually receiving the data that's needed to help with their care plan is extremely important as well. So this, like so many other ways, Peggy, that Pikeville Medical Center has led the way in healthcare within this region, is because we've made smart investments and premier investments, things like our new linear accelerator that we not only have one of, but we have two. Our second one will go online in March. And when we look at the investments we've made in our cancer program, and not only relocating it, but with the help again of the Governor and Congressman Rogers and Senator McConnell in making those appropriations available, that through the ML project, which was again Hal Rogers, his brainchild, who he fought for. Not only were we able to invest those dollars, leverage our dollars in places like our Children's Hospital, but we were also able to expand our cancer program. So on our 11th floor with our new infusion center on top of our specialty pharmacy, having a system that will allow us to navigate all those different service lines is extremely important. But it's more so important, as Travis asked in my opening question, is to tell who you are as Pikeville Medical Center. Again, we are not just an acute care hospital. We're a tertiary care center with a clinic, a level 2 trauma center, and several specialty service lines, and a transfer center. And as a transfer center, receiving patients this year alone from 45 different hospitals within the region, having the opportunity to communicate and again to send records efficiently and through secure platforms is extremely, extremely important. So we're very proud. I appreciate that question.
We've probably got time for one more question if there are any more.
A little trouble with my knee. I apologize. I'm Tammy Riley, Public Health Director in Pike County. I'm also the East Kentucky rep for Kentucky Health Directors Association. So any interesting national or federal, we talked a lot about partnerships. Partnerships or collaborations that will benefit hospitals, particularly rural hospitals.
And Tammy, with that said, especially through the pandemic, there was no better partner than we had than with the Pike County Health Department, and through your leadership and you're working with us in many different and vice versa. We were able to serve the county in so many different ways. So collaboration is why I think, and what sets Pike County ahead of a lot of different parts of not just the state but the country is having leaders that can reach out and work together. So we appreciate the work that you've done and certainly appreciate the partnership and representing our community in the ways that you do.
Well, on behalf of KHA, we want to again say thank you all so much for having us today. I would ask if you'll join me in giving Donovan and Nancy a round of applause. I'm sure we could probably go on for a few more hours. There's so much great stuff to talk about and work being done, but we won't. But again, thank you for being here today. Your attendance means a great deal to us. And as I said, it's been so important for the Kentucky Hospital Association to be able to hear from you all, talk about the role that your local hospital plays, and we look forward to continuing to work with you to advance healthcare in this part of the state. If we can ever be of assistance, please do not hesitate to reach out. And with that, I will hand things back over to the team, and again, just thank you for being here.